So what we're going to do on this patient, Susan, is we're going to begin autonomic response testing. Autonomic response testing, like it says in the name of it, uses the autonomic nervous system as a guide. Now, the autonomic nervous system is the automatic nervous system. What it does is it regulates all your normal body functions automatically without you thinking about it. It regulates the assimilation and digestion of food, hormone production, temperature control, osmolality and pH of the blood, all the timing and arousal mechanisms for reproduction, and your defense mechanisms, that's fight or flight. It's divided into the sympathetic and the parasympathetic, and the sympathetic part of the autonomic nervous system is what kicks on when survival is threatened. So, if you're in a corner and you have two Rottweilers on you and you don't have any place to go, you are totally focused on the two Rottweilers, no matter what anybody else says or does. That's what happens when you have a chronic health problem. Your autonomic nervous system, the sympathetic part, kicks on when survival is threatened. All right? So if you have a chronic health problem, it begins focusing on that, and your autonomic nervous system regulates all your normal body functions while it's in a protective mode against what's wrong. Now, we're able to tell what that is by a type of muscle testing called autonomic response testing, which is deeper than the other types of muscle testing that you've heard of, because it balances the autonomic nervous system, finds out the number one thing wrong, checks the immune system to see if the person is in an autoimmune dysregulation, and then balances that, and then goes on with the other testing. And also, the autonomic nervous system only travels into the extracellular space. It does not go inside the cells. The organisms of today have shed their cell wall, different from the organisms that were present when I was a child. They all had a cell wall, and our immune system could identify them by the information on the cell wall. Killer sites from the immune system would attach to receptor sites on the cell wall. That's how it would happen. Now they've shed their cell wall. They don't have a cell wall anymore, which makes them very pliable. By that I mean it's the difference between an octopus and a clam. An octopus can go inside of a milk bottle and get a shrimp when a clam is stuck on the outside. Okay? So when these organisms get in us, they go inside of our cells and use our cells as a cell wall, making it so the immune system can't get at it. It picks up the energetic frequency of it, but it can't get at it. So with a lot of other types of muscle testing, you're only getting it to go into the extracellular space, so you're missing what's wrong unless there's inflammation in the area, which puts it into the extracellular space where the autonomic nervous system is. So I'm going to demonstrate that a little bit right now. Okay, so the reason the muscle testing works, to show what the main issue is that the autonomic nervous system has its attention on, which is your core issue, is that there's a small sympathetic nerve that goes to every single muscle spindle of our conscious muscles as well as the unconscious muscles. That's from a peer-reviewed journal that was published in 1993. They did under an electron microscope. They found a small sympathetic nerve from the autonomic nervous system going to every muscle spindle. That's why when somebody comes up behind you and scares you, you go like that. That's not a conscious movement. That was for protection and survival, and that's why we do that. So when I get a change in muscle strength, what I'm getting is an autonomic response. So I'm going to do that now. Okay, now her muscle is strong. Okay, so what I'm going to do now is I'm going to see if her immune system is reacting in a autoimmune state or in a regular state like it's supposed to be. Put your middle finger and thumb together. Okay. Undo that hand and do this hand. Okay. So it was weak in one hand when I did that, which means that she has something interfering with the test that I normally get. And so that means that she has either a scar or something that her nervous system has its attention on. Now, okay, so she'll have her hand on her, over her navel, and then hold it real hard, and it remains strong. So that means that her autonomic nervous system is regulating in a protective mode against something. So what I can do then, I can put a box on. This box contains all different kinds of bacteria. 80% of the sympathetic part of the autonomic nervous system by weight is in the skin. So as soon as I set that on her, it already has it evaluated energetically. And then hold it over real hard. So the answer is not in that box of what the most important thing is. It's in this box. This is a box with parasites and algae. So I'll take some of those out. The answer is in my hand. Now I'm going to put these in one at a time. Not that. Not that. Not that. Okay? This is a scarce, so this is a type of parasite. So I can put everything else that I have. All the bacteria, fungus, virus, parasites, algae, everything I have on her. Well over 100 vials. And nothing makes any difference till I put the one more on. And we're able to quickly, non-invasively, surpass well over all the medical tests, find out what we got here and all that stuff. And we found out exactly what's wrong, that would be the most important thing to have treated on her, that her nervous system is most worried about. Okay, so that actually concludes the very first part of our examination. Our regular examination lasts 2 hours, because once we balance the autonomic nervous system and find the current issue, then we check using direct resonance. Direct resonance phenomena was discovered by Dr. Yoshiaki Omura from New York, a world-renowned physician that discovered the direct resonance phenomena. That is, if you have an identical substance outside the body that you have inside the body, it causes a weakness in a muscle. For example, like if you have a histologic slide of the human liver, I could go right over the liver, a muscle would go weak. I could put it any place else in the body, it stays strong. So if I have, for example, her parasite, and I go over her brain, it's not there. I go over her heart, it's not there. I go over her large intestine, bang, that's where it is. That's how we know. And we use this because direct resonance testing allows us to uncover the organisms that are living intracellular without inflammation. So we get much, much deeper than the medical tests have the ability to go, because many times, most of the time, they miss those things for years of what's really basically wrong with the person. Then after we find all those things, we find the herbal nutraceuticals and the immune system peptides that resonate with that, with all those various organisms. Then we test the terrain for the toxins that are present. Like I mentioned before, herbicides, pesticides, fungicides, plastics, toxic solvents, metals, and other toxins that are polluting the terrain that we'll have to get out with the laser detox to get the terrain clean, to get rid of the organisms. Then we test the immune system to see what it's reacting to in an autoimmune way. Those are sensitivities to foods, other things, as well as the toxins and the organisms that are present. And then we make up a treatment plan.